Alarmingly, in the US, nearly 1 in 4 adults are projected to be severely obese, defined as having a BMI of over 40 by 2030. To combat this, alongside conservative treatments like diet, exercise, and medication, bariatric surgery is a therapeutic option available for populations over a BMI of 40 or over 35 with at least one relevant comorbidity when all else fails, after careful consideration by a multidisciplinary team. As of 2018, there were 250,000 bariatric surgeries taking place in the US alone, and it's been suggested that as many as 30 million adults in the US currently meet their criteria. Although some might assume that bariatric surgery is done purely for cosmetic reasons, there's actually a multitude of studies showing its benefits for weight management and health. It has been found on average to help keep 35 kilos off at 12-year follow-up, lead 3 in 10 type 2 diabetics to long-term remission without anti-diabetic medication, and has shown in one study to reduce the risk of death by 89% as some examples. Therefore, in modern times, bariatric surgery does have its place in managing the obesity epidemic. That said, complications can arise from any surgery and shouldn't be overlooked, again highlighting the importance of the need for approval for multiple disciplines beforehand. Today, though, we are going to be discussing one other complication in particular: post-surgical site infections, the signs and symptoms to look out for, and the best preventative strategies to limit their risk. But first, as always, please take note of our disclaimer. A surgical site infection is an infection following an operation at an incision site or adjacent to the surgical incision. One reason they are dangerous is that they can lead to sepsis, which is when an infection triggers a chain reaction and starts to damage your body's own tissues and organs. Additionally, they can lead to failure of the surgical procedure, other surgical complications, organ failure, and even death in severe cases. They may be superficial, occurring at the skin or subcutaneous tissue level, deep at the muscle and fascia level, or even deeper than that, affecting the organs or body spaces. Symptoms of any one of these types are redness, fever, pain, tenderness, warmth, swelling, delayed healing, and pus at the wound site. Research suggests the more overweight someone is, the more likely they are to get a surgical site infection. For instance, it has been shown that while people between a BMI of 20 to 25 had an infection rate of 4.7%, those with a BMI of between 30 and 40 had an infection rate of 7.1%, and an infection rate of 10.6% in those with a BMI of over 40. That's double the chance of people who are severely obese than those of a healthy weight category. And there are a number of reasons for this. Fat tissue has less blood flow, which inhibits the delivery of oxygen and antibiotics to the area. And since our main defense against pathogens is oxidative killing by neutrophils, which rely heavily on oxygen, this means less protection against infections. Other possible contributors include hyperglycemia, because excessive high blood sugar impairs the immune system, which compromises wound healing, a susceptibility to other risk factors for surgical site infections like diabetes, and a more challenging time for obese persons preparing their skin for surgery versus those non-obese. Most often, the most common source of pathogens seen in post-gastrointestinal surgeries arises from endogenous patient flora, which means that the infection comes from within your body, from like a barrier between a sterile and non-sterile tissue being broken, for example, rather than the external environment. The two main infections from this are Staphylococcus and Streptococcus. Also, the flora of the gastrointestinal tract is another source of pathogens, which include aerobic and anaerobic gram-negative bacilli. On a quick side note, if you'd like to undertake our evidence-based and results-backed personalized Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Luckily, for anyone, several steps can be taken to limit the risk of surgical site infections. The current guidelines advise treating all existing infections, keeping a cool body temperature, and improving blood sugar regulation in the lead up to the surgery, as well as limiting hair removal at the surgical site just before because shaving irritates the skin, making one more prone to infection. However, the appropriate healthcare professionals should look after you regarding all this, as well as other safety precautions to be taken from their end. Lastly, another thing you can do to help with the prevention of surgical site infections, possibly down the line, is to stop smoking. This is because tobacco use causes blood vessels to narrow, which can lead to alterations in collagen metabolism, decreased inflammatory response, and relative ischemia. So this could be added motivation to finally kick the habit. Have you had any experiences with surgical site infections? We'd love to hear from you in the comment section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So that has been our video. Thanks for watching, and I'll see you next time.